This is the Polish Ambassador, featuring the Grouch and Scott Mace. Don't get it twisted.
I might be conscious, still I like to fuck.
I like it.
Do a little yoga, then lift some weights up. I be as I'm supposed to, perfectly imperfect.
Word.
Indulge in deep combo, get hyped when she
Hey, what's going on, guys? Welcome back to Kidney Disease Education Moment. I'm Steve Belcher. We had some technical difficulties on the last broadcast. I got abruptly interrupted by Facebook. They shut down the program. Not sure what happened there. So I just started another live broadcast. Please share this broadcast. We're going to be talking about the first 30 days. And I was getting into some good information when that situation happened. So please share this broadcast, guys. Let people know I'm on right now. I'm trying to find myself on here to start a watch party. So please share this broadcast. We're on. We're about to do the first 30 days. Not sure why I'm not coming up. Can't even start a watch party. So I know something must be good with this information. So the first 30 days. When you go to dialysis after being discharged from the hospital and you got to go to outpatient dialysis, I mean, you don't know what questions to ask, what's happening. And so what are you going to do? So your first week, you may be dealing with coping, right? You know, you may be dealing with the mental illness or mental health situation. You may be dealing with depression, anxiety, a host of a lot of mental health situation because you just got diagnosed with kidney disease. So what can you ask on your week one? How can you get help coping with all these changes that just happened being on dialysis? You may want to ask, what mood changes should you watch out for? How will you notice them? Maybe you may get angrier when you first start dialysis. Maybe you may be a little bit more moodier to your family members than you were. You know, that could be a symptom of coping with the situation that just happened. Who can help you with that? The social worker. I mean, the social worker can help you with a lot of things. And so if you just started dialysis, make sure you reach out to the social worker if you're dealing with any situation far as coping with dialysis. Now, another thing you want to think about is your new diet. That's a biggie. Your new diet. What are you going to do about this new diet? So what questions you may want to ask about that is, how do I need to change my diet? What kind of medicines can keep me healthy? How long will I be on dialysis? What happens during the dialysis treatment? I'm sorry, let me go back. How do I need to change my diet? And what kind of medicines can help me keep me healthy? The person you need to talk to about that is the dietitian. A lot of warriors don't know about that. They find out about the dietitian when you start dialysis. But as we had a dietitian on our show a couple of week ago, they suggest getting in touch with a dietitian when you hit kidney disease so you can manage your dietary intake to stay off dialysis. Another thing you want to think about is your dialysis treatment. What questions are asked in week 1? How long will I be on dialysis? A lot of warriors don't know that doctors write the orders for dialysis way before they get there. So the nurses, they already know. The doctors may say, we're going to run you 4 hours. They don't talk it over with you. They write the orders, and when you get to dialysis treatment and you start dialysis, you ask how long you running. They say 4 hours. You tell them you was in the hospital, you ran 3. And they say, no, the doctor wrote for 4 hours. You like, damn, no one told me. So you need to ask those questions. How long will I be on dialysis? And what happens during the dialysis treatment? You need to ask your doctor or nurse. Another thing to think about your first week of dialysis: support in and out of the center. What to ask: can family or friends keep me company during treatment? Not now. We all know COVID is out. They can't keep you company now. They don't even let nobody sit in the units with you. No family members. You got to sit either in the lobby now or in your car. Also, what should I call? What number should I call if I have questions? Make sure you get the number to the dialysis center. A lot of people don't get that because you may need to call them. Week 2. What to think about: paying for treatment. Now, a lot of warriors get hit with this and they don't know how they're going to pay for treatment, especially if they're not working. If they are working, they want to know if the insurance is going to take care of it. Maybe the insurance they got. I mean, it's a lot to think about. So what questions you want to ask in week 2? What kind of insurance do I have? Normally, patients have Medicare or private insurance. Another question: what does my insurance cover? Number 3, are there any community resources that can help me with my other costs of living? Something else you want to think about in week 2: preparing meals. What to ask: where can I find recipes that fit my new diet? What seasonings can I use? What should I avoid? Person you're going to talk to, the dietitian. Your medicines, that's another thing to think about. And see, this is what I'm saying. Let me just interrupt. We got one person on here, and that one person is all I need. But this is what I'm saying. The education is here, but the people are not. So it's just to go what the Bible says: my people perish for a lack of knowledge. So for week 2, what you're going to think about: your medicines. Who's going to pay for them? What new medicines do I need to take? Do I have to stop taking any of my other prescription or over-the-counter medicines? Who are you going to ask about that? The doctor or the nurse. Something else you want to think about week 2: what to do during treatment. What are you going to do? You just started dialysis, right? No one told you about it, right? What are you going to do during treatment? Your 3.5, 4-hour treatment. I wish I had some people to comment. It's Monday night, 10:30. I know a lot of warriors have insomnia. So all I can do is keep putting out the information, and hopefully people will come back afterwards and look at it. It's just sad that there's only 2 people on a broadcast is giving life-saving information, and I could turn on and see a guy riding around Los Angeles filming homeless people that has 80 people looking at homeless people that's not really making a difference that's going to change that information, that situation on Skid Row. But this information right here can change lives that people don't know. So when they go into treatment for the first time, they know what to expect. I'm not just talking at the top of my head. I'm reading information. So I'm just, a little discouraged, but no, 3 people is great. Even one. So what are you going to do during treatment? If you just started dialysis, it's the new normal, and you were in center. Questions to ask. Can I eat during my dialysis treatment? How should I dress for treatment? A lot of people don't know that a lot of the dialysis clinics, their temperature is set low. So patients need to bring blankets or some type of covering, because a lot of people complain of being cold. When your blood is taken out of your body through a machine from 3 to 4 hours, you tend to be cold, right? So take a blanket with you. Wear old clothes. So don't wear no suit or no fancy clothes to dialysis, because if you're holding your access site and you start bleeding again, it get on your clothes, right? So you want to wear old clothes, maybe some sweatpants, sweatshirt. You got a catheter, cut a V-neck right here so they don't have to pull your shirt down to get to your catheter and put the catheter out, and this is kind of up on your neck, right? Get an old clothing, and then afterwards you can change. What can you do to keep busy during treatment? Well, you could do some work. You could play games on your phone. A lot of people got mobile phones now, Androids, right? Watch TV. You can sleep, talk on the phone, crossword puzzle, internet, read. There's a lot of things you can do. You can start a business while you're on dialysis. Just do something that takes your mind away, but still be aware of what the people are doing with your care. Week 3 of the first 30 days of dialysis. What to think about? Transportation. How are you going to get there? Can you drive yourself to dialysis? Now, what to do during treatment, I just told you. I don't need to tell you that a technician can tell you that. I just told you the stuff that you can do, but on this paper, they say who can help. And it says technician, right? Who can help? Listen, technician, they don't got time to be sitting down your first 30 days going over all this with you. They busy with 2 other patients. So week 3, but you may need to even think about this before week 3, is transportation. Can you drive yourself to dialysis? What transportation options do you have? What if you don't have a car? What if you don't know how to drive? What if you depend on public transportation? Where's the dialysis facility? Is it across town? So you may want to think about the state bus or Uber or Lyft. And you can talk to the social worker to help you out with that. Tom says only to dialysis, not back from. Oh, okay. Okay. You get a ride to dialysis and then somebody come and pick you up. Yes. And I encourage you, if you don't have a ride, to maybe ask a neighbor, a friend, relative. And that advice asks, can you drive yourself home? Yes, James, a lot of people drive themselves home. A lot of people go to work from dialysis. I know people who drive home, and on their way home, they had to turn back around because they started bleeding from the access site. What they say is they're driving, right? And they feel something warm on their arm. And then the next thing they know, they pull over and it's all this blood. But when they come back, we take off the jacket, right? And I'm gonna be a little graphic. When you take the jacket off, you got all this blood that clotted that looks like gelatin, right? And you see the tape is all bloody. And then we clean it off their arm, try to clean the jacket or the shirt with peroxide, and then retape them and bandage them up and let them sit for a minute just to monitor them and let them go. But that happens. And Tom says, you hitchhike? Are you serious? I mean, you got to do what you got to do, brother. And I admire you, man, that you're going to get to dialysis any way you can. You got some people I've known, Tom. There's a lot of people I've met in my career, patients who, if they ain't got a ride, they're not going to dialysis, point blank. We call them up, it's an hour past the time they were supposed to be there, and we call them on the phone, Tom, right? And you're like, Mrs. Jones, you coming to dialysis? I can't find a ride. And they very adamant. I mean, if you try to explore options of trying to get there, they get, a lot of people get defensive. And okay, you want to reschedule, or if you can't come in, we just tell them watch your fluids. If you run into any breathing problems or trouble, go to the nearest emergency room. So we always got to throw in that clause. But I would say that anyway as a nurse, go to the emergency room if you're not feeling well. All right, week 3. Another question you should be thinking about, your phosphate binders. If you haven't already discussed that with the doctor or now look, some people been seeing a nephrologist before they get into renal failure. So a lot of this stuff, they already have in check, like the phosphorus binder, because the nephrologist is following them. But what about the people who go to the emergency room and haven't or don't have a nephrologist and find out that way? Because that happens, because we all know 9 out of 10 people have stage 3 kidney disease and don't even know it. So if you don't know you have stage 3, you'll get to stage 5 sooner than later. Thus, if you go to end stage, you're in the emergency room because you develop some symptom with nausea, vomiting, edema, which is swelling in the ankles, puffy face, itching on the skin, fatigue, whatever other myriad of symptoms that come with end-stage renal disease that will land you to the emergency room. You'll get it, whoever's on call, that's the nephrologist you're going to get. Whoever's on call that weekend or that day, you go to the emergency room, that's who you're going to get. It could be a butthole. It could be the nicest kidney doctor in the world. It could be a kidney doctor, bow tie, coming in with spectacles on, looking down at you with the glasses, looking at your chart thinking, you don't know any better and talking to you like, all these technical jargons and, one that don't even care, right? Just give it to you straight shooter and don't care about your feelings or nothing. You had those doctors. You had those doctors are people too. They're human beings. Because they got MD, because I got a nurse behind my name, RN, that doesn't, what's that? That doesn't take me away from being human. At the end of the day, I may get frustrated and say something to a patient that I shouldn't have said or whatever. Same thing with doctors. You may have a jerk to come in there because you came in early in the, 2, 3 in the morning. He could be out, out with his lady or doing something in bed, whatever. And now he got to come in or he's calling where normally they don't come in. Let me just say that, right? Some don't come in. Some just, they get a call and they call the nurse on call and give you the orders, right? And they don't see you till the next day. I'll be the first one to see you. I mean, that's just how it is. And so I say all that to say, when you go in that way, you don't know nothing. Nothing. And then when you go to the unit, you didn't even meet the dietitian. She may not be there the day you go. How many people been to dialysis on their first day and the dietitian or the social worker wasn't there? And they said, oh, they'll be here Friday or Tuesday or another day. You may not have seen them for a week because they was on vacation. I mean, you can't make this stuff up. And that's why I do this show. And that's why, I'm just a little disappointed, but I get over it. And a little disappointed because I just wish we can have 60, 70, 80 people that are dealing with this disease that may know someone who started or somebody's family member has started or their cousin. I mean, people start dialysis every day. People are on the internet and Facebook looking for kidney disease groups to join because they don't have any answers. People are in these large groups, 20,000 plus, 8,000, 7,000. And God bless those groups, and there are groups out there for patients to express their emotions, their feelings, and experience, and what they're going through, and what they hate, and this and that. We get it. That's why I do these shows. I swear to you, I get it. That's why everyone involved in urban health outreach media is dedicated doing these shows because we get it. And we just need the people. But 6, 7, 8, 1 is good. But we have to have, or should have, hundreds. What good, and I'm going to continue after this, what value other than entertainment does a video of someone walking around, include myself, but a video of someone fighting, policing, or someone filming just the streets where they at, if it doesn't add value to one's life, how can 90, 100 people watch other than for entertainment purposes? So, yeah, thank you, Dad. Yeah, thank you, brother. We do. And I want to get with you on that. Really buckle down on that, because the information needs to get out there. I'm not just talking about the United States. I'm talking about overseas. Our warriors overseas in the UK and Africa, India, China, all over. We all deal with the same thing, just different environments. Treatment options. That's a big one in week 3. Again, if you've been seeing a nephrologist, right, for 3 months, 4 months, you already know what your treatment options are, right? You already know. But again, for the person who just got diagnosed, who don't know dialysis or hemodialysis from a can of paint, they're not thinking about the treatment options. They may not even know about home dialysis. They may have a home business. They may be self-employed. They may go to a 9-to-5. But no one in the hospital told them you can go home. They just said, hey, we want you to go to this. You know, what normally happens is you're sitting in the hospital bed, right? And you start to feel better. And it's maybe like 4 days you're in the hospital, right? You kicking back, you flipping the TV. Maybe you just finished breakfast. You're feeling good. You're watching the television. And here comes the team, or the what's the manager? Wow, what's that manager? And I can't think of it on the top of my head, but it's the caseworker. Clinical casework manager, comes to your room, asks you, where do you live? And gives you a list of dialysis units in that area. No one said anything about home dialysis, which could be more beneficial to you, right? The longer the treatment, the better you feel. That's the concept, because we know the kidneys work 24/7. If you get dialysis 3 hours, 3 days a week, you only get 9 hours of treatment. If you get 4 hours 3 times a week, you're getting 12 hours of treatment, compared to 5 days a week at 3 hours, you're getting 15 hours a week. You see what I'm saying? So if you didn't know that and you get into the treatment center, say you had to give up something, you had to lose your job because the clinic didn't have an appointment time to fit around your schedule. And then all of a sudden, a month, 2 months in, someone tells you about home dialysis, but now you're not even working. You lost your job. You think that doesn't happen to people? It does, because information falls through the cracks. Falls through the crack. No one tells no one nothing. In-center dialysis is not your only option. What treatment option fits best with your lifestyle? That's what you got to decide here before you leave that hospital. Which treatment option fits best with your lifestyle? Not the dialysis clinic lifestyle, but your lifestyle. Remember, you're the most important person here. Can my dialysis be performed overnight? Of course it can. Who are you going to ask? The doctor. Right? Sometimes, I mean, you can ask the nurse, but these are the questions you need to ask if you just started dialysis, your treatment options, and no one told you about it in the hospital. I mean, that's what I'm saying. We had a lot of people on here. We can find out how many people were told about home dialysis or alternative treatment options in the hospital. During my 34 years in dialysis, right? And let me see, I did 10 years as an acute nurse, right? And I can tell you, I've been in a lot of patients' rooms across the United States, dialyzing patients with their family member in the rooms, and the doctors come in, and the doctors don't mention anything about transplant. They don't mention anything about home dialysis. They come in, they talk about the numbers, the dialysis treatment, and then they're on their way. And then, like I say, the caseworker comes in days later, and they look for a treatment facility in the community where that patient lives. So it's just ridiculous that no education. The education they may get is from the dialysis nurse, such as myself. So week 3, and something else you need to think about: what to know about my dialysis center. Are there any rules I need to know about at my dialysis center? You don't find out the rules until you go there and sign the patient rules and regulations, patient rights rules and regulations. That's when the consent form, they tell you everything to expect in dialysis, right? And can you take a tour of the facility? I encourage you, if you're about to start dialysis, if you're about to start and you know somebody about to start, I encourage you to interview the unit. You can go to any dialysis unit you choose to, right? Anyone. So instead of the doctor saying, I want you to go to this unit, don't just follow the doctor. Don't be a follower, be a leader. Go to the units. You interview them. How is your staffing call out? What's the ratio? What's the patient ratio per staff? Do you have a high rate of call out? Do you have a high staff turnover? How long has the administrator been there? How long has the charge nurse been there? What about the clinical manager? You need to ask these questions so you can get a better understanding how that facility runs. All right, we're going to go into week 4 and I'm going to end it. What to think about? Travel. Can I travel while I'm on dialysis? Absolutely. Will my health insurance cover transfer to another unit? Talk to the social worker. Most likely it will. Supplements. How can I supplement my nutrition? Because we know dialysis strips a lot of nutrients from your body. Are there any tools that help me stay on track with my diet? Talk to your dietitian. Treatment options. Should I be referred for a kidney transplant evaluation? What kind of vascular access do I need? Who are you going to ask about that? The doctor. And ask questions about your access and the vein mapping and all that. You know, when you go and get the workup for your vascular access, that's the time when you really need to ask questions about, are your veins small? And if they small, what other options you got? You don't want these doctors chopping on your arm and you walking around with 3-4 different accesses, right? No, the more you know, the better. All right. And the last but not least, caring for your vascular access. How can I take care of my vascular access? Also, what activities could hurt your vascular access? You can ask the technician while you're at the unit, talk to your doctor, or you can reach out to us, Urban Kidney Alliance or Urban Health Outreach Media. We have tons of education shows that can keep you, your family member, or friend on track with kidney disease information, education, or any other information we can help you or your family or friends with. So with that being said, I want to thank everyone who tuned into this broadcast for watching. I'd like to apologize for the abrupt interruption of the last broadcast by Facebook, and I will complain about that. But again, share this broadcast. Let's come together as a kidney community. Let's get more warriors over here to Urban Health Outreach Media to get them educated and aware of what's going on, guys. Again, we just want to be here for you, raise awareness, and to decrease, not increase, but decrease kidney disease in this community and worldwide. God bless you and thanks for watching. Have a good night. Peace.
I've been walking beneath streetlights. I've been walking, cause I can't find peace on these nights. I've been walking, but my strides are getting slower. Still I'm walking, but I don't know where I'm going. I've been looking for love, but only found deception.
This is the Polish Ambassador, featuring the Grouch and Scott Mace. Don't get it twisted.
I might might be conscious, still I like to fuck.
I like it.
Do a little yoga, then lift some weights up. I be as I'm supposed to, perfectly imperfect.
Word.
Indulge in deep combo, get hype when she twerk.